चालू कर देंगे। नमस्ते, I Dr. Dr. MP Sharma, Professor and HOD Department of Physiology and Biochemistry, Faculty of Homeopathy Science. And today's my topic is spleen. The spleen is an organ found in all vertebrates, similar to structure to have a large lymph node and it acts primarily as a blood filter. The word spleen comes from ancient Greek alternative spleen. The spleen plays an important role The spleen plays an important role in regard to red blood cells, erythrocytes, and the immune system. It removes old red blood cells and holds a reserve of blood, which can be valuable in case of the hemorrhagic shock, and also recycles iron. As a part of the mononuclear phagocyte system, it metabolized hemoglobin removed from the census red blood cells, erythrocytes. The globin portion is the hemoglobin is degraded to its constituent amino acid, and the heme portion is the metabolized to bilirubin, which is removed in the liver. The spleen houses antibody producing lymphocytes, and it is white pulp and monocytes which removes antibodies, coated bacteria and the antibody coated blood cells by way of the blood and the lymph node circulation. These monocytes, upon moving to injured tissues such as the heart after myocardial infarction, turns into the dendritic cells and the macrophages, while the promoting tissues healing. The spleen is a center of activity of the mononuclear phagocytes system and analogous to a large lymph node, as it is absence cause of the predisposition to certain infections. In human, the spleen is the pulse in color, and it is the upper gradient quadrant of the abdomen. The spleen is the underneath the left part of the diaphragm and has a smooth convex surface of the that faces the diaphragm. It is underneath the ninth, 10th, and 12th ribs. The other side of the spleen is divided into the two regions as an interior gastric portion and a posterior renal portion. The gastric surface is directed forward, upward, and towards the middle. It is broad and concave and is the contact with the posterior wall of the stomach. Below this is a contact with the tail and tail of the pancreas. The renal surfaces is direct downward and downwards. It is somewhat flattened, considerable narrower than the gastric surfaces, and in regular and its relation with the upper part of the anterior surface of the left kidney and the occasionally with the left adrenal glands. And there are four ligaments attached to the spleen: gastrosplenic ligament, splenorenal ligament, and cholicosplanchnic ligament, and the phrenicoelic ligament. Now, 90% confidence interval of the spleen length by abdominal ultrasonography by the height of the person. A person whose height is 155 to 159 centimeter, women's 6.4 to 12 centimeter, 160 to 164 centimeter, women 7.4 to 12.2 centimeter, whereas men 8.9 to 11.3 centimeter. In 65 to 69 centimeter, women 7.5 to 11.9 centimeter, whereas the men 8.5 to 12.5 centimeter. 170 to 174 centimeter. It is in women 8.3 to 13 centimeter, whereas in male 8.6 to 13.1%, 1 centimeter. And lastly, the 159 to 179 is 8.1 to 12.3 centimeter. Similarly, in a male, 8.6 to 13.7 millimeter. The measurement. The spleen is in healthy adult human is approximate 7 centimeter to 14 centimeter in length. An easy way to remember the anatomy of the spleen is the 1 into 3 into 5 into 7 into 9 into 10 into 11 rule. The spleen is 1 to 3 by inches, 3 by 8 by 13.13 centimeter, wide, weight approximately 7 ounce, means 1200 grams, 200 grams, and lies between 9 to 11 rib on the left hand side of the along with the axis. On 10th rib, the weight varies between 1 ounce to 8 ounce. Standard references range correlating mainly to height, body, weight, and the degree of the acute congestion, but not to sex or age. And this is the spleen diagram which shows the spleen along with the attachment with the vertebra. Now, where the blood supply? Blood supply, visceral surface of the spleen near the middle of the spleen is long feature. The hilum, which is the point of the attachment on the gastrosplenic ligaments and the point of insertion of the splenic artery and splenic vein. And there are other only different references. Effect Effectious vessels. The spleen is part of the lymphatic spleen, and both the short gastric arteries and splenic veins are supplied with blood. Ravi? Ravi?